Talia.
And I'm Jasmine, and we're the hosts of Fusion Teen Talk Show.
We welcome you guys to our third episode of Fusion. And Jazz, today we're talking about a topic that is no longer taboo.
During this episode, we're going to talk about the different factors that we as teenagers need to be aware of as we enter in the world of dating and relationships. It's about sexual realities.
Telling you all we know. Watch and see how you will grow. 'Cause teens and parents are bridging lines of communication on Fusion.
Fusion Teen Talk Show.
So today, we have Miss Kia Smith here. Hi, Kia. She's a writer and a former teen mom. So, Kia, tell me about your story and I guess like how teens can relate to your story.
Well, my story, I was a senior in high school, preparing to go to college. I was SGA president, was on the dance line, and then I found out I was pregnant. So initially it was shock. It was the feeling of being a statistic and just feeling like my choices had been dramatically limited.
Right.
And that everyone's perception of me would be extremely different.
Right.
So I just had to make some hard decisions on where I was going to go to college, what that was going to look like, and I had to put in a lot of work to make sure that my dreams were still possible, despite the fact that here I am pregnant with a new baby and, at 18 years old.
It's like a lot for a teenager to go through emotionally.
Oh, absolutely.
And I just want to kind of focus on the emotional impact that teenagers kind of go through. What do you think, or what do you say to that teenager that feels like lame if they're not having sex?
Lame is very subjective.
Yeah,
it's based on people's opinions and their personal opinions. So what I would say to that teenager is you don't let anyone else make your decisions for you by giving you a subjective label like lame. What is lame to one person is not lame
like
to
so
another.
Cool to someone else.
Right. So you have to make the decision that's best for yourself and that that fits into your future plans,
I think sometimes we as teenagers, like we make decisions and sometimes we don't know how those decisions will affect us in the long run. But since you've gone through so much, what do you think if a teenager thinks that they are ready to have sex? So what do you think they should even think about? Like, what do you think their mindset should be emotionally for them to even move forward to that?
Emotionally, I think you have to know yourself, which a lot of times you think you do that as a teenager, but that is the best time to get to know yourself without the responsibilities or the dealing with the responsibilities and consequences of sex and being in a sexual active relationship. So it's just knowing yourself, loving yourself, and being okay with you. If you're unable to be alone, if you're one of those people who always has to be in a relationship, that's one of the key signs that there's something missing in you. And maybe you should spend some time getting to know yourself before you go and try to fulfill yourself in a sexual relationship with another person.
How is you as a teenager? You're seeing all of these sexual things on television all the time, and you think that is the norm, when it's actually not necessarily the norm, because what do you say to the teenager that I guess like is seeing that and thinks that that is normal?
You have to remember that what you see on television, whether it is a scripted sitcom or reality-based dramas with Mimi and Stevie J, all of this is for entertainment purposes. Everything is exaggerated so that you will laugh, so that you will tweet and talk about it, so that you will tune in to see what's happening next. That's not normal life. And with that, you have to always think about the consequences. Are you willing to accept the consequences that are coming from emulating what you see on television? You really just have to think about, am I willing to take that risk? Am I responsible enough to deal with the consequences that come along with me being sexually active?
So like those risks that I think sometimes teenagers take risks sometimes and they don't even think about it. So what do you say, like, what is a premeditated kind of thing to kind of like get yourself there?
I think that goes back to planning. And things are sporadic, especially with teenagers, but if you see that you're coming to the point where, okay, I'm gonna have sex, don't be afraid to do what's necessary to protect yourself. condoms, birth control, getting regular exams. Have those conversations proactively so that when it happens sporadically, you're prepared. Don't wait to think about birth control when you're in the backseat of a car. It's too late then.
Right.
Think about it in advance and just try to, you know where your head is, and try to be responsible enough to make the decisions so that you don't have to deal with long-term consequences.
Right. Thank you, Kia.
We're going to take a quick commercial break, but when we get back, we're digging deeper into the topic of sex, and we're asking the questions that we need to know the answers to. Stay connected with Fusion on Facebook,
Twitter,
Instagram, and YouTube. So what is the next step once you feel like you are ready for sex? We have some great guests here who are going to help you here at Fusion to answer that question. We have sex ed professor Marcus Dumas, and we also have Dr. St. Louis, who is the creator of Happy Mommy, Happy Baby. Thank you so much for joining us here on Fusion.
Thank you for having us.
So now we want to start with you, Dr. Lewis. You work with, or as a physician, we want you to tell us what is like the number one thing you feel like teens should know about sex.
The number one thing they should know is that you can get pregnant with just one time. It doesn't take more than one time to get pregnant. You also need to know that you can get sick, but just one time. Just one encounter, you can catch an STD. And so I think a lot of times when we're young, we think we're invincible and nothing can happen. And if we have sex the first time, nothing happens, then we think that, you know, nothing's going to happen to us. But it only takes one time to get pregnant.
Okay, and you?
I think exactly the same thing that Dr. St. Louis said. It's very important to know that it only takes one time. So that's one thing that I really try to push when I'm out in the community educating other people is that it only takes one time. So I would agree with you.
Okay, what different contraceptives or methods of protection are out there for teens who are sexually active? And do you need their parents' permission to get them?
Well, when I see teenagers, I always encourage them to get their parents involved. Whether we think about it or not, the only person who's going to bail us out at the end of the day is either your mom or your dad. They're going to be the one who are there for you through whatever it is that you're going to go through. And so I always encourage them to discuss with their parents. In terms of contraceptive, whatever is available to an older woman, the same things are available to adolescent. I also encourage teenagers to come in before they become sexually active. I think it's really important to think about having sex as opposed to just, you know, to avoid finding yourself in the moment.
Okay, so speaking of parents, like what is the best way that you guys feel like teens can communicate with their parents in terms of when they're ready to have sex?
It's always going to be awkward. I'm a parent. I have 2 children, and it's always going to be awkward. I think if you find the opportunity to go out with your mother or the parent that you're most comfortable with, and if it's not a parent, a grown-up that you trust, that you feel most comfortable with, it's finding that adult that you trust and that you're comfortable with and just talk about it. It could be a coach, it could be a teacher, it could be an aunt and uncle, so it doesn't necessarily have to be your mom or your dad. It has to be an adult who can help you make responsible decisions, who can help you find the answers to the questions that you have, and not to rely on your friends, because your friends are probably struggling to find the answers as well.
So once again, I would just agree with everything she just said. I've seen a lot of commercials that are running now, commercials or different ads inside of magazines that kind of get the parents to ride with their child, or maybe if you see some type of ad inside of a magazine, you might say, what do you think about this? And that kind of opens up the gateway to actually having that conversation. Once again, you know, it is a very uncomfortable subject, but I think that's one of probably the best ways is to really, when you're sitting around maybe watching television, might be in a car listening to some music, you might catch something on the news, catch something in a magazine. That's the time to really just sit down and say, well, you know, I feel such and such way about this, and that's it opens up the door, and next thing you know, the parent is engaging, and you'll never know, but sometimes parents might even come a little bit straightforward and say, well, you know, this is what I did when I was a little bit young, and I would prefer you don't do it, but these are going to be some of the options that we can actually address as far as that's concerned.
Okay, there are some teen myths kind of going around, you know, so we just want you guys to clear it up. The first one would be, can a girl get pregnant if she's never had her menstrual cycle?
Yes, it can happen. It can actually happen. Sometimes you will not necessarily have a period, especially as you're developing and your body is growing. And just because you're not having a period, it does not mean that you have not started to ovulate. All you need is to release an egg. And you're not always going to have a period. So yes, it can happen.
Okay, I hope that answered some of the questions out there for you guys.
Well, we're all kind of blushing now, but it's okay because this is an important topic. So we're going to talk about the consequences of being sexually active. We'll be right back. Be a blessing. Sow a seed into Fusion Teen Talk Show.
Join the movement and donate to the All Things Fusion GoFundMe fundraiser. So I'm here with Tatiana, one of our audience members, and she's going to answer a question for us. What do you feel are the consequences of having sex?
I would have to say either teen pregnancy, unplanned pregnancy, or the contraction of sexually transmitted diseases.
That is a great answer.
That's right, Tatiana, but is that all? Let's ask our guests. We still have him here. You being a teen mom, what are kind of some misconceptions of being a teen mother? Because I know like there's so many shows like Teen Mom Out and all those kind of things, and maybe they do show an accurate perception of teen motherhood, maybe they don't. But you being a teen mom, what is your personal take of, I guess, of the misconceptions?
I guess the biggest misconception that accompanies being a teen mom is that you can do it all on your own. As a teenager, you think that you're Superman and invincible and you can conquer the world. But when you are faced with taking care of this child while you're still in school, while you don't have a job, while the things that you never even considered, like health insurance, come up, life insurance, when all that comes up, you realize the importance of having a support system with your family and your friends, and just having people there to guide you as you figure out how you're going to raise this life.
Well, coming back to, I guess, the consequences, I want to ask both of you, Dr. St. Louis and Mr. Dumas, like, what are things that teenagers can look out for if they think that they contracted an STD?
Unfortunately, there's nothing. That's probably the most difficult part, whether it's for my teen patient or my adult patient, is that there are really no true signs of having an STD.
Wow.
So more often than not, when a patient comes in and they ask to be tested, it's because they know that they haven't been very smart about the choices that they made.
Right.
Or sometimes someone will come for a routine visit and then you'll check them and something comes back positive. I would say for women, maybe vaginal discharge is something that you can be on the lookout for. Pain when you're urinating is something else. At Planned Parenthood, where I work also, for male patients, if you have pain with urination, that's something that you can look for, but don't rely on any sign. Really, the key is for you to make smart choices if you're going to be sexually active.
I mean, I would echo everything she's just said. And one thing that I try to teach in my college courses is the importance of always getting, if you're sexually active, always getting tested every 3 to 6 months. And the other thing that becomes very important is that you must realize that every STI, sexually transmitted infection or disease, it has a test for itself.
Right.
So just because I go to see Dr. St. Louis and I want to get tested for HIV, she can't tell me if I have herpes or if I have gonorrhea or chlamydia, because you have to take another test. So it's very important to get tested for all different types of sexually transmitted infections, not just HIV.
Wow. So what are resources, I guess, for teenagers to get tested? Is there an age limit if a teenager would like to get tested?
There are no age limit. I strongly recommend any of the Planned Parenthood health centers. For one, we often will offer testing for free. We also offer testing at a much lower price than you would if you don't have insurance or you're trying not to let your parents know. And we also have some really good health educators.
Right.
So that's a great resource. Of course, as I mentioned earlier, talk to your parents. Go see your parents, your mom's gynecologist if you're a woman, and then if you're in college, of course, your student health center is always there for you, and the information is confidential. So even if you go see your mom's gynecologist, they can't discuss your health information, and that's something that you have to remember, that we cannot, as physicians, when I test you, you are my patient. I can't disclose anything unless you give me permission to disclose something.
Right. So Kia, you, I guess, being a past teen mother and stuff like that, what do you say to a teenager that maybe is embarrassed about maybe going to get tested or just is insecure in that regards?
It's part of the responsibility that comes with being sexually active. If you feel like you're going to be ashamed to buy the condoms, to go and get tested, to go and take the preventative measures, then that's one of the early signs that you're not ready to engage in a sexual relationship. So just remember that confidentiality, you know, that you do have with your physician, and it's nothing to be ashamed of. If you're having sex, you want to be proactive and protect yourself.
Because of all the amazing resources that are out there, never feel embarrassed about getting tested. So let's get an audience question. Somalia.
Thanks, Jazz. I'm here with Erin, and she has a question.
My question is for Miss Smith. I was wondering if the person you decided to lose your virginity to, were you in love? And if not, what was your reasoning towards having sex with them?
Well, that was a personal question. Kia?
That's actually a great question, and what I will say, being completely transparent, is my reason for having sex the first time was probably the worst reason a teenager could ever have, and it was out of curiosity. I was hearing all of my friends talk about it, and I was like, so what is this? And it was completely irresponsible, and it goes to the peer pressure, and not necessarily one-on-one peer pressure, but just from society when you're always surrounded by sex, that gives a message to teens, if I'm not doing it, then something may be wrong with me, then I'm not the normal one. So my advice would be, number one, don't let society make your decisions for you. Always make sure that when you decide to have sex, whether it's your first time or your 100th time, that it is a reason that is completely personal to you.
Stick around. We'll be right back with some resources and some advice for your life prep. Today, we will be talking about a topic that is plaguing our age group.
We're making a pledge to end bullying.
A lot of times you might hear hurt people. So they take this energy and cause, mental, physical distress. They taunt people, they tease people.
I think it's always been a big issue. It's just nowadays we have 24-hour news, we're on Twitter and Facebook and Instagram and stuff. So people are constantly putting out media. And so we just hear about it more than we used to.
Welcome back to Fusion Teen Talk Show. We discuss the emotional, physical, and life-changing consequences of teens being sexually active.
So now we want to offer you guys some advice and some resources to take with you. So we're going to go down the line, and we want you guys to give our teens some advice who are sexually active and what programs or resources are out there if they find themselves pregnant or with an STD.
That's a great question. If you are already sexually active, and I think that it goes back to the question that was asked to one of our panelists earlier, make sure you're being sexually active for the right reason. If you're not, you can always stop. There's no reason that you can't stop. If you are going to be sexually active, you also need to make sure that you're being smart about it. You only get one chance, and I always tell my patient that you only have one body. Things that you do now have consequences 10, 20, 30 years down the line. I see patients who are adult who oftentimes are struggling with trying to get pregnant because of things that happened to them when they were adolescent. Wow. So it's really important to remember that.
The one piece of advice that I would give is a person who's actually having sex. It's very important to have that conversation with your partner. As Usher says, get them papers. So it's very important, very, very important that you get your partner's papers. And one of the coolest things, actually, I have a lot of people that actually go get tested together. So people that are young, go get tested together, be it your best friend or be it your partner. And then you actually can find out right then on the spot after they get the papers. Show me your papers. If we're going to have sex, show me those papers. Put it around your neck. Do something like that. I mean, it'll work. I promise you. So, and then also there are just a lot of people in the community that are actually willing to help. Like she was saying, Planned Parenthood, Greater Than AIDS. A lot of different communities have health fairs. Go to the health fairs. They do them for free. And that's really all I have to say about it.
I just want to piggyback off of what he's saying. And if you're not willing to have that conversation with your partner or to go and get tested with your partner, then you don't have the trust in the relationship where you should be sexually active. That's another red flag that if we can't do this together, we don't need to have sex together.
Well, thank you. We want to thank all of our amazing guests. Thank you, Dr. St. Louis, Mr. Dumas, and Miss Kia. I want to see it in a Kia.
And we also want to thank our lovely audience. So give a round of applause for yourselves. We hope we answered all your questions about sexual realities. Protect yourselves. Your body is your temple.
We'll see you next time on Fusion Teen Talk Show.
Tell